Today, we are going to do a quick but high-yield review of retinitis pigmentosa, commonly abbreviated as RP, one of the most important inherited retinal degenerative disorders affecting vision progressively over time. Retinitis pigmentosa is not a single disease, but rather a group of genetically diverse disorders characterized by progressive degeneration of the photoreceptor cells of the retina. The retina is the light-sensitive layer located at the back of the eye, and within the retina, there are specialized photoreceptor cells called rods and cones. Rod cells are mainly responsible for vision in dim light and peripheral vision, while cone cells are responsible for central vision, color vision, and visual acuity. In retinitis pigmentosa, the rod cells are affected first, followed later by cone degeneration. Because rods are predominantly located in the peripheral retina, the earliest symptoms involve night blindness and peripheral visual field loss. Over time, as cones become involved, patients develop central vision impairment and severe visual disability. The disease is inherited genetically and can follow autosomal dominant, autosomal recessive, or X-linked inheritance patterns. Multiple gene mutations have been associated with RP, including mutations involving rhodopsin and other proteins essential for photoreceptor structure and function. These genetic abnormalities lead to progressive photoreceptor dysfunction and eventual cell death. In a healthy retina, rods and cones continuously convert light into electrical signals that are transmitted to the brain. However, in retinitis pigmentosa, the abnormal genes gradually damage these photoreceptor cells, leading to degeneration of retinal layers and characteristic visual loss. The image beautifully demonstrates this progression by comparing healthy retinal layers with the RP-affected retina, where photoreceptor death progressively narrows the functional visual field. Clinically, the earliest and most classic symptom of retinitis pigmentosa is night blindness, also called nyctalopia. Patients often complain that they cannot see properly in dim lighting conditions or struggle to adapt when moving from bright environments into dark rooms. This occurs because rod cells, which are responsible for low-light vision, are affected first. Initially, patients may ignore these symptoms or think they simply have poor night vision, but over time the disease progresses slowly and continuously. As peripheral retinal degeneration worsens, patients develop constricted visual fields, commonly referred to as tunnel vision. In tunnel vision, the patient loses side vision and can only see objects directly in front of them through a narrow central field. Everyday activities such as driving, walking in crowded areas, or navigating stairs become increasingly difficult. Patients may frequently bump into objects or people because they cannot perceive peripheral surroundings adequately. The progression is typically gradual over decades, and eventually central vision may also become affected when cone degeneration advances further. At advanced stages, severe visual impairment and legal blindness can occur. On examination, one of the most characteristic findings in retinitis pigmentosa is the classic bone-spicule pigmentation seen on fundoscopic examination. These black pigment deposits in the peripheral retina occur because of migration of retinal pigment epithelium cells into the retina after photoreceptor degeneration. Another hallmark feature is attenuation or narrowing of retinal blood vessels due to reduced metabolic demand from degenerating photoreceptors. Optic disc pallor may also be present because of chronic retinal degeneration. These three findings together, bone-spicule pigmentation, attenuated retinal vessels, and optic disc pallor, form the classic triad of retinitis pigmentosa frequently tested in examinations. Several diagnostic tests help confirm the disease and evaluate progression. One of the most important investigations is electroretinography, commonly called ERG. ERG measures the electrical activity of retinal photoreceptors in response to light stimulation. In retinitis pigmentosa, rod responses are severely reduced or completely absent, making ERG one of the definitive functional tests for diagnosis. Visual field testing, also called perimetry, demonstrates progressive constriction of peripheral vision and helps monitor disease progression over time. Optical coherence tomography, or OCT, is another useful imaging modality that provides detailed cross-sectional images of retinal layers and helps assess macular involvement or associated complications such as cystoid macular edema. Genetic testing has become increasingly important because identifying the specific mutation may help guide prognosis, family counseling, and future gene-based therapies. When discussing treatment, it is important to understand that currently there is no complete cure for retinitis pigmentosa. Management mainly focuses on slowing progression, preserving remaining vision, treating complications, and improving quality of life. Historically, vitamin A palmitate supplementation has been studied because some evidence suggested it may modestly slow disease progression in selected patients. However, high-dose vitamin A therapy must be monitored carefully because excessive intake can cause liver toxicity and other adverse effects. The image also highlights an important warning regarding vitamin E. High doses of vitamin E should generally be avoided in RP patients because some studies suggest it may accelerate rod photoreceptor degeneration. Nutritional supplements such as omega-3 fatty acids, lutein, and zeaxanthin may also support retinal health, although they do not cure the disease. Complications like cataracts or cystoid macular edema should be treated appropriately because managing these conditions can significantly improve visual function in affected individuals. One of the most exciting developments in recent years is gene therapy. Since retinitis pigmentosa results from genetic mutations, researchers are developing therapies that directly target defective genes. Certain specific forms of inherited retinal degeneration, such as RPE65-related disease, can now be treated using approved gene therapy approaches. This represents a major breakthrough in ophthalmology because it demonstrates that inherited blindness may become partially treatable in selected patients. Researchers are also exploring stem cell therapies, retinal implants, and bionic eye technologies to restore some degree of visual perception in advanced disease. Although these therapies are still evolving, they provide hope for future treatment possibilities. Management of retinitis pigmentosa goes far beyond medications alone. Since the disease progressively affects vision, rehabilitation, and lifestyle adaptation become essential components of care. Low vision aids such as magnifiers, special lenses, adaptive lighting, and electronic visual devices can help maximize remaining vision. Orientation and mobility training teaches patients how to navigate safely in daily life despite peripheral vision loss. Many individuals benefit from occupational therapy and adaptive daily living skills training to maintain independence. Psychological support is equally important because progressive visual loss can produce anxiety, depression, social isolation, and emotional stress. Support groups and counseling services help patients cope with the long-term impact of visual disability. Another important concept highlighted in the image is prognosis. Retinitis pigmentosa is usually a slowly progressive bilateral disease, meaning both eyes are affected gradually over time. However, progression rates vary significantly between individuals depending on the genetic subtype. Some patients maintain useful central vision for many decades, while others experience earlier severe visual impairment. Night blindness often appears years before major daytime visual disability develops, making it an important early clue for diagnosis. Early recognition, regular ophthalmologic follow-up, genetic counseling, and supportive rehabilitation can greatly improve long-term adaptation and quality of life. To summarize this quick review, retinitis pigmentosa is an inherited retinal degenerative disorder characterized by progressive loss of rod photoreceptors followed by cone degeneration. The earliest symptom is night blindness, followed by peripheral visual field constriction leading to tunnel vision and eventually central vision loss. Classic examination findings include bone-spicule pigmentation, attenuated retinal vessels, and optic disc pallor. Electroretinography is a key diagnostic test showing reduced rod function. Although there is currently no definitive cure, management focuses on slowing progression, treating complications, providing low vision support, and exploring emerging therapies such as gene therapy and retinal prostheses. Most importantly, retinitis pigmentosa is not simply an eye disease affecting vision alone. It significantly impacts mobility, independence, emotional well-being, and overall quality of life, making comprehensive long-term care essential for these patients.